Thank you. All right, well, we'll go ahead and get started. I know we'll have a few other individuals from DHHS joining us. Um, but just wanted to welcome all of our participants to our call that we have quarterly. Appreciate you taking the time. For those of you that don't know me, I'm Amanda Slater. I'm one of the Assistant Deputy Directors here at the Department of Health and Human Services. And I'm joined here today by many of our colleagues throughout the department for representing various OUs. Just a quick couple virtual housekeeping reminders. I think at this point, most people are aware of them, but I always want to make sure if somebody's new joining that they're aware of it. We do have closed captions available. What you do is just scroll down to the bottom of your Zoom window and you can select that live transcript in the menu bar so that you can enable those closed captions. Additionally, this meeting will be recorded for those that cannot attend. Once the recording has been completed, we'll get it uploaded and send that via email to everyone that was invited. Additionally, any time during the meeting, please enter your questions into the Zoom chat feature, and we will try our best to answer all of those questions during the Q&A section of the meeting. Additionally, you can submit questions prior to these meetings or at any time by emailing them to our CQI team, and we will go ahead and drop that email in the chat so that you have that, but feel free to email that at any time. With that, I am going to turn it over for a legislative session update to Alyssa.
Thanks, Amanda. For those of you that don't know me, my name is Alyssa Smales. I'm the Assistant Director in the Office of Legislative Affairs. And we're just going to do a quick summary of some things that impacted DHHS and potentially your businesses from the session. Thanks, Danielle, for presenting for me. So can we pop to the next slide? So this is a quick bill overview. Over the course of this session, 910 bills were numbered. 568 were in the House, 342 were in the Senate. We did have 17 new House members this year, which means that we didn't have as many bills numbered in the House as we did last year because they were just kind of getting their feet under them. So consequently, 582 bills did pass. It's the second highest in history after last year. Last year was the highest in all of history. And of those, 165 bills were tracked by DHHS. So this slide's about the budget bills. DHHS fiscal year 26, we have an $8.7 billion budget. That's including Medicaid. New general funds were $30.7 million ongoing and $13 million one-time funds. And then 63% of DHHS's requests that were in the governor's budget received some level of funding, and it was an extremely tight budget year. So the fact that we got as much as we did, we were really happy with. Do you want to pop to the thank you? So this is some funding that may impact contracted providers. The DSPD waiting list got $6 million ongoing starting in fiscal year 26. Mandated additional needs, $11.2 million. Baby Watch Early Intervention Services got $1.5 million one time. Home health medical rate increases were $1.1 million ongoing. Nursing home and ICFID Medicaid rate increases were $2.5 million ongoing, and skilled nursing facility behavioral health got $1.5 million ongoing. And then there were some more direct awards that were named in legislation by legislators. So these are just some of our highest priority bills that passed this year. I'm going to pop to the perfect. So SB 297 was Congregate Care Amendments by Senator McKell. This bill creates a Congregate Care Advisory Committee outlined in code. In this bill, I think it has 8 members. And then it directs the Office of Licensing to set minimum safety requirements for congregate care programs, review proposed admissions, deny or accept a program's proposed admission criteria, and creates a congregate care ombudsman that we're working on developing within the Office of Ombudsman here at DHHS. HB 347 is Social Services Program Amendments. Representative Dunnigan ran this for us. It removes the dispense as written override for all psychotropic medications except atypical antipsychotic drugs. This will result in more prescriptions coming through the preferred drug list and hopefully save the state money. Adds at the department can approve adult substance use and mental health providers as deemed status sites. So that's kind of great. HB 534 was ran by Representative Lubay. This allows adult protective services to make substantiated findings of abuse, neglect, or exploitation if the alleged perpetrator refuses to provide certain documents. So it just gives a little bit more protection for people in these care facilities. HB 33, Child Welfare Reporting Amendments, was run by Representative Watkins. This requires that DCFS notify law enforcement when the division determines that a person knowingly made false reports of child abuse or neglect. In previous code, it said that we may report to law enforcement, but it changed that may to a shall. And the effective date for that is May 7th of 2025. SB 24, Child Abuse and Torture Amendments from Senator Ipsen. This makes imprisonment mandatory for the offense of child torture. And then it classifies child torture as a violent felony now. SB 57, Newborn Relinquishment Amendments, was run by Senator Hinkins. It changes the definition of a newborn to 90 days instead of 30 days, so that up to 90 days you can relinquish a newborn at safe haven sites. And then it provides funding to increase the education. Oops, sorry, let's bump back. About the changes of the law and to update materials currently available on utahsafehaven.org. So you can find more information about that there. And that's the ones that we felt like were the most impactful, highest priority for DHHS. And I'll give it back to you. Thanks, Amanda.
Yeah, thank you, Alyssa. As always, DHHS has a lot of money and policy decisions that happen during our legislative session. So as Alyssa mentioned, these were some of the ones that we felt had the biggest impact on our providers, our department. There are obviously a lot of others that do touch our department. I believe we track almost 200, 300 bills every session that affect our department in one way or another. So just thank you for going over that, and thank all of our providers for cooperating through that. With that, we are going to go ahead and shift to our operational unit updates. Again, just a reminder, as they're presenting, if you have questions, feel free to pop those in the chat. And at the end of everybody presenting, we'll move to a Q&A section. If you have questions that are not related, feel free to drop those and we can cover those as well. So with that, I'm going to go ahead and turn the time over to Spencer Hall.
Hey, thank you, Amanda. We are in the process of updating terms and conditions, and you may have seen a recent amendment or will be seeing recent amendments with some changes to terms. We have 8 changes. 4 are related to insurance, and then 4 are new terms. With regard to insurance, we're really excited about some of these changes. The first one is we are removing the requirement for an additional insured endorsement. And we know this has been a pain point for some of you over the years, and risk management gratefully agreed to let us remove that requirement. There was also a requirement that insurance be written on an occurrence form, and this is as opposed to a claims made basis. We are removing that occurrence form requirement. So your insurance may be written on a claims made basis or an occurrence form. We don't care anymore. The third is we're removing the AM Best requirements. There are requirements that the insurance company had to meet certain AM Best ratings. So that should make it easier as well. The fourth, in order to get the first 3 changes, risk management did require us to change our subcontractor insurance requirement. And this requirement was changed from saying that subcontractors must hold reasonable levels of insurance to state that subcontractors must hold the same levels of insurance that DHHS requires the contractor to hold. So those are the insurance changes. The new terms include a new term on artificial intelligence. This term requires contractors to obtain written permission from DHHS if you use state data with artificial intelligence, and also contains some indemnity clauses relating to artificial intelligence. The second is there's a term that prohibits contract funds from being used from any prohibited discriminatory practices as defined by Utah Code 53B1-118. And this is per HB 261. The third change is really a change in terminology more than a substantive change in the contract. It's a remediation clause. So in the past, we referred to corrective action plans. Our attorneys felt that might be confused with corrective action on the federal level. So we changed our terminology to use the term remediation plan. In substance, a remediation plan is the same as what a corrective action plan was in the past, and it allows DHHS to enter a plan with a contractor if there is some contract violation that can be remedied short of terminating the contract. And the last change is an addition to our publicity clause. We had an existing publicity clause in contracts that require the contractor to obtain prior written approval from DHHS prior to advertising or publicizing matters related to the contract. The addition is this requirement is now imposed upon subcontractors at any tier. So if you subcontract, you would be required to include a term in the subcontract that requires the subcontractor to obtain DHHS permission if they intend to publicize the contract. So those are the new changes to the terms, and that's all I have. I'll pass back to you, Amanda.
Perfect, Spencer. Thank you for that. And appreciate the work that you've done. I know the insurance specifically, a lot of providers had concerns with it. So I appreciate you and the team working to be responsive to those concerns. With that, I'm going to go over and turn it to CQI. It looks like we have both Carrie and Jessica here today. I believe I'm turning it over to you, Carrie.
Yes, thanks, Amanda. And we just have one quick update and reminder. We are once again, the Office of Service Review will be hosting listening sessions throughout the state with all of our agreement partners. Announcement went out yesterday and a couple of weeks ago that lists where these will be at, and the times for those. But April 15th, 16th, and 17th of next week will be in person, and then we'll be hosting a virtual option for those who can't make it in person on April 23rd. So we look forward to seeing you all there if you can make it and hear your feedback that you can share with us. And that's all we have, Amanda.
Thank you, Carrie. I will now go ahead and turn it over to the Division of Child and Family Services. It looks like we've got both Kyla and Kevin here today, so I'm not sure which one of you are leading it.
Hi, I just have one exciting announcement. So for DCFS and Juvenile Justice Youth, we have 2 contracts about to open for placement. Our family-based placement contract for both level 4 foster parents and professional parents. And then we will have a small rotating staff group home. So your residential support home for DCFS or JJS youth. If you want notifications about those, please make sure that you're up to date with Bonfire so that when those go live, you will get an email that they are ready. And if you ever have any questions prior to that or once they're live, you can send me an email. I'm happy to chat through what it looks like. I know we've got some people coming from maybe the disability world stepping into this DCFS JJS side, and we're happy to do some Q&As on what those differences look like. So we're just really excited to get this going. Those should be out in the next week or so.
Perfect, Kyla. Thank you. Very exciting. Next, I wanted to first excuse Rachel with JJYS and Chanel with Office of Substance Use and Mental Health. They were not able to be here today, but if you have questions for them, feel free to drop them and we'll make sure we'll try to answer them or we'll follow up offline on that. So with that, I will turn it over to DSPD, and it looks like we've got Marcy here today. So I will kick it to you.
Thanks, Amanda. So we just have a couple of things. Our next provider contract amendment will be coming out July 1st rather than April 1st, as there were a few more elements that we had to add into it. An RFI will be going out related to these changes later this month, so watch for that. And then DSPD, along with Aging Services, Integrated Health, and USDC, has been participating in a peer learning collaborative that addresses direct support professionals and staffing issues. And so we've had 2 educational sessions. The first one was on April 3rd, and that one was it was called Workforce 101, and it was ways to stabilize your workforce. We will be getting that recording posted on our website pretty soon. And then the second one is on technology, integrating technology into human services. That one will be on Thursday, April 24th, and you should get a reminder email that either the day before or that morning. And we're hoping to also send out the recording of the other one along with it. So we've gotten good feedback that it's been really helpful for providers with staffing issues. And so we just want to invite people to attend that. Thank you.
Perfect. Thank you so much, Marcy. Appreciate that. I wanted to say we have Joseph with Medicaid Long-Term Services and Supports here. It looks like he doesn't have any updates today, but is here to answer any questions that you have. And then with that, I want to go ahead and turn it over to the Division of Licensing and Background Checks. It looks like we've got Shannon, Travis, and Daphne here. So I will kick it to you, Shannon.
Great, thanks, Amanda. Just a couple of announcements. One, we've talked about this in the past and done a little bit of it, but we are gearing up for updating a pretty substantial update, we think, of all of our rules in the 2025 and then through, the fiscal years we're in the middle. So fiscal year 26. We are, as we've talked about before, we are invested in making sure that we are doing our due diligence in our statutory authority to uphold safety, respect, and well-being of Utah's most vulnerable populations. And so in doing this, we're going to undertake a comprehensive review of our rules. We are looking to prioritize regulation that significantly enhances health and safety while eliminating administrative burdens associated with measures not proven to improve health and safety, and to avoid duplication of requirements that other government agencies may administer, and then we are also, for some reason, looking at. So all that because I want to prep you that because we highly value the input of providers, provider organizations, we are going to be sending out fairly soon some surveys to ask for feedback from you all with those questions in mind of what aspects of the rule, and we'll send out the specific rules that apply to what aspects of the rules are essential to retain, which could be removed without compromising health and safety. Are there additional requirements we just haven't thought of that you guys have seen in your provider community and been like, "Ooh, that would really help"? And do our rules contain requirements that are also subject to verification or oversight by another government agency that we may look at if we're just duplicating without adding anything to that? So just wanted to give you a heads up. You'll get more information, but if you want to start those juices flowing, to start thinking about all the things you would like to change, please do that. And also just want to be clear that this does not replace the open public comment period that is required when a rule is posted. So this is just the start. There will still be public comment. So if you forget something and you don't get it in right now and the rule gets posted and you're like, dang, you can still give a public comment. The other thing I wanted to announce, because we're really excited about this, we have received funding for the division to for fiscal year 26 for the division to hire 3 new FTEs to support our DSPD providers. We are not sure where those will go within the division yet, but they will be like their primary focus will be supporting the DSPD provider community to support those DSPD clients. So we're pretty stoked about that. We know we've had lots of conversations with our DSPD providers on some bottlenecks that could be alleviated with additional personnel. So that is all I have, and I'm going to pass it over to Daphne for Office of Background Processing updates.
Sorry, it took me a second to find that mute button there, but thank you for that. So Office of Background Processing updates, just so that you are aware, our Rule 50114 should be available soon here for public comment, and we will be sending out a notice when that is available. So just be watching out for that email and watching our website for when that's available in public comment period, as well as we will be having an in-person DAX training on May 20th, and that will be here in Salt Lake at the multi-agency state office building. And we will also be sending out more information, but I just want you to get that date on your calendars before that email comes out so you can be saving that for us. Thank you.
Thank you, Shannon and Daphne, for those updates. It looks like those are the last updates we have for you all today. So we will move to our question and answers portion of this meeting. As it looks like some of you are doing, please go ahead and answer, put your questions in the chat. We'll do our best to answer all of these today. If not, we can follow up in the follow-up email with those responses. If you can, in the future, submit your questions in advance, we would appreciate that, just so we can be prepared. We always try to be responsive to the questions that you all have. You can ask anything of the division representatives, whether they presented on this a topic today, or if it's something you've been wondering about or have a question on, feel free to get that. With that, I am going to go ahead and pivot to a few questions. And I'm going to kick it to you first, Spencer, if you're prepared. The first one is, can you go more into depth with AI restrictions? We utilize AI with our Google Drive and subscriptions. Gemini is integrated into all sheets and documents.
Sure. So the term restricts the use of AI with state data, and state data is a defined term in the contracts. And it means all confidential information, non-public data, personal data, and PHI, so protected health information. The concern with artificial intelligence is some tools may use this data to learn from and share it in a context outside of your domain. So others might be able to see some aspects of that data. So the concern is trying to protect the data such that it doesn't get outside of where it should be. There is a DTS policy referenced in the term and condition. And if you want to reach out to me and you haven't seen your amendment yet, I can send you the term. But DTS has certain privacy and security requirements to guide the use of artificial intelligence to ensure that that confidential information isn't being exposed outside of where you'd want it to be.
Perfect. Thank you, Spencer. And as you mentioned, people can reach out to you directly. I did drop your email in the chat so they can send you an email if they have questions on that. With that, I'm going to ask you a few more questions, if you don't mind. They're all kind of related. Sure. Will subcontractors include host homes have the same insurance requirements as a provider as well?
Okay, on this one, I wish I had a better answer for you. I have a meeting at 1 o'clock on this exact subject. A concern was raised by a contractor, and we're appreciative of them raising the concern. And we're going to discuss that and address it. And we will have more information shortly regarding HHS and PPS contract homes, insurance, and also automobile insurance.
Perfect. And then I'm gonna move to another kind of, there's a few more insurance updates or questions. Are you going to be sending updated forms for the insurance requirement?
Okay, I'm not sure what is meant by this question. For proof of insurance, you would submit a certificate of insurance. We do not require you to submit an updated certificate of insurance. We're lessening the requirements. And so monitoring checks on those insurance requirements as they monitor contracts. So we don't have a new form per se for the insurance requirements. It's just a lessening generally of the requirements in the terms and conditions.
Perfect. Thank you, Spencer. And I'm going to take liberty to maybe turn that question around a little bit to where I'm assuming there might be a question. Is if individuals have not received the updated terms and conditions that have those details, when should they expect to be getting that? Because I'm assuming that's where that will detail the insurance changes.
Yes, it will. So first, you can find the updated terms on the PCM website. So you can go and look for them there. Otherwise, the contracts will be amended in the coming weeks. So within the next few weeks, we expect to get to everything.
Perfect. And there's another question about do the insurance and advertisement requirements apply to HHS and PPS? You just mentioned we don't know yet, so more information to come on that one. And then can you repeat maybe just a brief overview of what the insurance changes are to providers?
Sure. So we are dropping the requirement for an additional insured endorsement. We are dropping the requirement that the insurer meet certain AM Best ratings, and we're dropping the requirement that insurance be written on an occurrence basis. And we are adding a requirement that subcontractors must have the same levels of insurance that the prime contractor has.
Perfect. Thank you, Spencer. And then it says there are insurance requirements posted on the DHHS DSPD website. Is that going to be updated? I said to you, but I'm assuming that might be you and Marcy, because you did mention they've been updated on the PCM website. But if those are linked also on the DSPD website, Marcy, maybe you can jump in and help Spencer here. Will that be updated as well?
Make a note of it, and I'm sure we will be updating it, but I'll make sure.
Perfect. Thank you. And then we're going to kick back. Spencer, you're on the hot seat. So I'm going to ask you one more question and then I'll kick it to someone else. On AI, is there restrictions even if we're using a HIPAA or BAA AI account?
Yes, there are. And again, it gets to the issue of we want to ensure that there are proper privacy and security controls in place to ensure that that data is not used elsewhere and exposed to people outside your organization.
Thank you, Spencer. And I think that, AI is a new space and we're all really excited about it and the value it can bring, but there is also the security risk and we need to ensure that people's information is protected. So thank you all for being willing to navigate this with us as we're ensuring that the proper safety protocols are in place. With that, I am going to shift to Marcy. It looks like there were a couple questions that were actually submitted ahead of time. So I'll start with the first one. As a newer provider established within the past 2 years, I understand that connections between support coordinators and well-established companies with extensive experience and financial backing often result in these companies being prioritized over smaller providers. This can lead to ISOs and support coordinators working directly with larger providers, bypassing newer or smaller companies. In the interest of fairness, what measures, if any, does DHHS have to place to ensure that support coordinators are conducting due diligence and providing clients with equal opportunities to interview a range of providers?
So that's a very long question and it's got a very long answer. So to mitigate the concern, DSPD employees are the ones who send out the ISOs to ensure that they go to all providers, both for people already in services, anyone making a change to their services, or someone new coming into services. The ISO may narrow the scope of what a person or family is looking for, such as the geographic location. So that can take it down to where it doesn't go out to as many providers. But when someone is in services, the responses are then sent to the person or their family or their guardian and the support coordinator. And families then choose who they're going to interview. So if there are concerns that someone's choice was not respected or was unduly influenced, then we ask that you reach out to our constituent services representatives, and that's at dspd@utah.gov, or the phone number is 538-4091. I'm sure we can probably post those in the chat. But when someone is new to services, the state support coordinator does all of the initial planning, and the supports the family is interviewing and selecting the providers and the support coordinators. That all goes through our internal support coordinators. So they are the ones that you would be working with if it's a new person coming into services. So constituent services is really good to ensure that people have gotten choice, that they're getting informed choice, and that things are not just being chosen for them. So we do our best to make sure that people are getting the choices on those services.
Perfect. Thank you, Marcy. And we have another question that is kind of related, but not fully. It says, I believe I noted the answer to this, but I would like clarification on whether some more support coordinators are permitted to share personal email correspondence with providers that they have connections with when a client is seeking other options due to dissatisfaction with their current program. If this is not permitted, is there a designated contract or department where I can report these concerns and provide evidence of such occurrences?
So if a support coordinator is arranging service options outside of the ISO process, that would be a violation of the person's choice unless the person has identified an alternative support coordinator themselves. So outside of the ISO process. This would also be a contract compliance issue that should be reported to OSR at their website. So we want this stuff going through the ISO process and the right channels. So if support coordinators or any contractor sharing personal information about a person receiving services with another person or entity who is not authorized to have that information or need to know the information, they could be violating HIPAA rules. So it is a concern if things are being shared, especially if it's not encrypted and it is protected information. So if you're aware of a situation like that that's happening, we would ask that you report it to our privacy officer, which is Tyler Black. His email is tdblack@utah.gov, and then they can look into that as well and make sure there's no HIPAA violations happening.
Thank you, Marcy. And then I'm going to ask you one more question. Is there an estimate on when the next SCE contract draft will be released?
So the new contract goes into effect July 1st. We've done the RFI processes, we've gone through and gotten feedback. So the next step is that the contract will come out. I would imagine you'll be getting information about that in June, but it does take effect July 1st.
Okay. And then a follow-up to one of your previous questions. If a support coordinator is directing or strongly encouraging leaving one provider for another, is that a violation?
Yes, and I would say those are things that you should report to OSR. They can speak for how they want that done, but because that is that is not giving people choice. You could also go to our constituent services. So either one of those you could go to and report those things.
Perfect. Thank you, Marcy. And just want to kind of throw, it looks like the questions are kind of slowing down a little bit here. If there are any questions, please feel free to drop those in the chat or send an email. Got one more quick question for you, Daphne. There was a question if you would confirm again when that in-person DAX training is.
Absolutely. So we have put that in the chat, but that is May 20th, 2025 here at the Multi-State Agency Office Building. I said that backwards, but you guys know what I mean.
Perfect. And will you be sending out an email with those details in the
Correct. Yes,
week?
an email will be coming with all of the details. Just save the date.
Perfect. Thank you so much. All right. It looks like that is our last question that we have. I will give it just a minute. So if anyone else has some burning questions, they can drop those in there. Otherwise, I want to value everybody's time and not extend a webinar longer than it needs to be. Looks like we do have one last question. So we'll answer this before we wrap up. It said, and I'm thinking this is probably a DSPD and a contract question. So I'm going to Carrie and Marcy and Jessica, you guys can help on this. In our contract, it states that as a provider, we are not able to bill for any services prior to receiving an approved 1056, and we are not able to accept verbal approval from a person's support coordinator to provide or bill for us services outside the approved 1056. But we have emergency placements and a 1056 is not ready. Then it seems that the support coordinator takes a long time to get the 1056 sent over. How should we handle this? I'm not sure which one of y'all want to jump in to answer that. Marcy, if you want to. I'm assuming it's DSPD because they're referencing a support coordinator.
So that language was in the contract that came out in July, and we have made some changes to that. And I'm gonna have to look and see if those are coming out in the July or if they have. I believe they're coming out in July. That will change that language a little bit to make that a little bit more flexible for those emergency needs. Yeah, I'm gonna have to look. I can't remember exactly what the language is, but it is being changed to allow flexibility.
Perfect. Thank you, Marcy. And if they're having some concerns with that currently between now and July, who should they reach out to with any questions or concerns?
You could reach out to our finance team.
Perfect.
Or they could probably our finance team would be the best for that because they're the ones that approve the budgets and it all goes through them. And that's what some of the flexibility is having that stuff in the works.
Yeah, I think that just a good reminder, there's a question about we're able to bill for services. I always hesitate to answer questions like that because there is very specific to the point of if it's an emergency. So I would suggest, as Marcy mentioned, reach out to the DSPD financial folks with your particular situation and they can help you answer that. There was another question that was in here that said, all of the budget information you shared, is this set in stone for this fiscal year and next? I'm asking due to the federal proposed for cuts. So I'll go ahead and take that answer and then definitely if anyone wants to jump in. The information we shared was from the state fiscal year or legislative session for 2025. That is currently the budget as we have it. So there's not any changes that we're aware of on that. It would require a legislative change to adjust any of those amounts. As far as federal funding proposed cuts, I acknowledge there's a lot of uncertainty with those right now, and we are closely following those. At this point, we haven't received any formal notices of cuts. If for some reason we are, we will definitely communicate that to our providers. But at this point, I'm not aware of any notices other than ones that we got a couple weeks ago from the federal CDC and the SAMHSA, Substance Abuse and Mental Health Association. There were a couple cuts that went into a place that affected our department a couple weeks ago that did affect some of our contracted providers. If you were affected, you should have received an email and a notice on that. With that, I think that answered it. I'm sorry, it's a little bit of, we don't know on the federal, but we will update you as we do know. And then there's a couple more emails. It said, I believe I answered this, or I submitted a question ahead of time, but it wasn't answered. I believe it will be answered through the DAX training. Should I bring these questions to the chat only moving forward? No, you're welcome to submit those ahead of time. We will double check. Maybe it got missed in the transfer from those previous questions over, and I apologize that was missed. You're welcome to drop it here in the chat or email Daphne's team if you need that question answered right away. Otherwise, yeah, definitely bring it to the training if you still have outstanding questions. And Daphne, I don't know if we've already dropped your OBP email in the chat, but if not, would you mind just dropping it so they can submit their questions? Thank you.
Yep, I'm doing it right.
Perfect. And then I know I got a couple other questions. It said, can you share the finance folks' contact info? Based on the previous question, I'm assuming, Marcy, that's for you. So if you don't mind just putting the email address of your finance folks in the chat so that individual can email. And then the next one is, how do we get additional staff on the emails about these meetings? Yeah, so on the reminder that gets sent out of these meetings, there is a little link that says, I think it says, if there's somebody that should be invited to these meetings or something to that effect, somebody help me. There's a little thing that says to share this meeting with others. You can actually click on that and you can sign other individuals up. The list that we pull shows our is from the contracts list. And so if you only have one email on there, that's who would get it. And maybe our comms, Danielle's on here, maybe she could tell us what it says that they can sign up on.
Yep, I have it pulled up. I can share my screen so everyone can see it. Just one moment.
Perfect, thank you. I was trying to go off of memory.
Oh, no worries. I have it right here, so it's all good. So this is the email that you'll receive in your browser. Down here, right, this purple button, this first purple button says, do you know someone who should be invited to our quarterly updates? Sign them up here. When we click that, let me make sure that's switched over. Perfect. It's switched over to the other screen. They can sign up to get these notifications right here.
Perfect. Thank you so much, Danielle. And I think absolutely, if there's people that should be notified of these meetings, feel free to please share that, have them sign up. We always want to make sure that we can be responsive to you all. With that, I think we've got all the questions that have come in today. So thank you all for attending. We do appreciate having the opportunity to give you updates and appreciate your questions. Oh, one popped in. See, whenever I say we're wrapping up, there's always a question. And it says, I'll answer it quick and then we'll wrap up. In the past, private support coordinator background checks will automatically fund for us, but that didn't happen this year. I don't know if Daphne or Marcy. No, I'm not quite sure what the question is there. We might have to follow up on that one or get.
Yeah, I would say let's follow up on that one. You can either send us an email about that and we'll get the answer and maybe be able to better understand the question to provide a good answer for you.
Yeah, thank you. And then There's another one, and I'll be honest, I don't know what all of these acronyms stand for, so I'm phoning a friend. I'm hoping one of y'all can help me on here. Apologies for missing this, but did you share when the new D, SNP, SMACSs will be sent to the plans? Does anyone know what those are? Phoning a friend. All right, I'm getting a lot of head shakes here, so I'm thinking that none of us are aware. So if you want to just go ahead and email that CQI email, maybe some more details, exactly what you're looking for, then we can answer that question offline. Apologize, I know there's a lot of acronyms out there, and normally one of my friends can educate me on what that acronym stands for, but every once in a while we're a little at a loss. So thank you for that. Again, just appreciate all that you all do to serve the Utahns and really ensure that people are healthy and safe in our custody. We couldn't do this alone as a department without our contracted providers. So thank you for that. Watch for the email with this recording and then a follow-up email reminding you of the next quarterly meeting, which will be on July 8th, same time, 12 p.m. We appreciate your partnership, your collaboration. Have a wonderful rest of your day.